NCLEX RN Study Guide 2026 questions to check your understanding easily. Question 1. Which of the following is a contraindication for treatment with tissue plasminogen activator, TPA? Option A. Worsening chest pain that began earlier in the evening. Option B. History of cerebral hemorrhage. Option C. History of prior myocardial infarction. Option D. Hypertension. The correct answer is option B. History of cerebral hemorrhage. A history of intracranial bleeding is an absolute contraindication for thrombolytics, TPA, due to the risk of fatal hemorrhage. Question 2. Following myocardial infarction, what is the primary purpose of encouraging frequent leg exercises and ambulation? Option A. Increases fitness and prevents future heart attacks. Option B. Prevents bedsores. Option C. Prevents deep vein thrombosis, DVT. Option D. Prevent constipations. The correct answer is option C. Prevents deep vein thrombosis, DVT. Ambulation and leg exercises promote venous return and are critical in preventing the formation of deep vein thrombi. Question 3. Which symptom should the nurse expect a patient to exhibit if they are in cardiogenic shock? Option A. Hypertension. Option B. Bradycardia. Option C. Bounding pulse. Option D. A confusion. The correct answer is option D. Confusion. Decreased cardiac output in cardiogenic shock leads to poor cerebral perfusion, manifesting as confusion, restlessness, or agitation. Question 4. Which of the following is a hereditary risk factor for developing atherosclerosis? Option A. Family history of heart disease. Option B. Overweight. Option C. Smoking. Option D. Age. The correct answer is option A. Family history of heart disease. A family history of heart disease is a genetic/hereditary factor that increases an individual's risk for atherosclerosis. Question 5. Which of the following facts about claudication is correct? Select all that apply. Option A. Oxygen demand is greater than oxygen supply. Option B. Pain often occurs during rest. Option C. It is a result of tissue hypoxia. Option D. It is characterized by cramping and weakness. The correct answer is option A. Oxygen demand is greater than oxygen supply. Claudication is ischemia-related pain, cramping/weakness, that occurs when the muscle's oxygen demand exceeds the available supply. Question 6. Which instruction should be included for a patient with peripheral vascular disease, PVD? Option A. Walk barefoot whenever possible. Option B. Use a heating pad to keep feet warm. Option C. Avoid crossing the legs. Option D. Use antibacterial ointment to treat skin lesions. The correct answer is option C. Avoid crossing the legs. Crossing the legs compresses vessels and can further impair already compromised circulation in a patient with PVD. Question 7. A patient diagnosed with Raynaud's disease, vasospastic disorder, is most likely to fit which description? Option A. An adolescent male. Option B. An elderly woman. Option C. A young woman. Option D. An elderly man. The correct answer is option C. A young woman. Raynaud's disease predominantly affects young women, typically between the ages of 15 and 30. Question 8. A pregnant patient on bed rest for 6 days has sudden shortness of breath and chest pain. What is the most likely cause? Option A. Myocardial infarction. Option B. Pulmonary embolism due to DVT. Option C. Anxiety attacks. Option D. Congestive heart failure. The correct answer is option B. Pulmonary embolism due to DVT. Pregnancy and prolonged immobility are major risk factors for DVT, which can lead to a life-threatening pulmonary embolism. Question 9. What is a significant and dangerous complication associated with thrombolytic therapy used in stroke treatment? Option A. Hair embolism. Option B. A cerebral hemorrhage. Option C. Expansion of the clot. Option D. A resolution of the clot. The correct answer is option B. Cerebral hemorrhage. The primary risk of thrombolytic therapy is major bleeding, most dangerously a cerebral hemorrhage.